Okay, Megan. So today we're just gonna talk about some of your precautions that you have from your surgery, and then we're gonna just go through some exercises to kind of get that shoulder moving a little bit. So our precaution that we're gonna go through is you are not allowed to raise your arm up above your shoulder level. Okay. So we're gonna stop. Okay. And then just a couple other things we want to watch out for is when you're sitting or laying in bed, just prop up your arm a little bit like on some pillows so it's not just sitting down like this all the time.
Okay.
And then we're going to watch your incision site, just make sure there's no infection, it doesn't get really red, hot, anything like that. And then we're going to watch your posture because I know with the surgery it kind of makes you want to just like go like this, like that. Something, I just want you to like kind of pinch your shoulder blades together. I don't want you to just open up your chest. When you're sitting and standing, just try to always sit like that. So if we sit here like this, your muscles are going to get tight and we're going to kind of get stuck right in there. Okay? So two exercises we're going to do. The first one's called shoulder shrugs. So literally what you're going to do is just stir your shoulders up to your ears. Yep. Good. We'll do 3 sets of 10. Okay, perfect. The next thing we're going to do, we're going to use the edge of this couch. So right arm on here, you're going to lean forward, your left's going to hang, and you're going to use your body to just let your arm swing. We're going to do forward and backwards, side to side, and you're going to do like circles like this.
Okay.
So just let your body do all the moving.
Pendulum.
Like a pendulum. Yes. Good. And then side to side and circles. Okay.
Okay, so now we are 3 weeks post-op, and you have a super tight upper trap and levator. And so we're going to go through a few manual techniques. Sorry. Okay, I'll keep going. We're going to go through a few manual techniques first to stretch that upper trap. And so the first one that we're going to do is just for your upper trap in general. So we're going to side bend you opposite, rotate towards, and then we're going to flex. Okay, and then we're going to hold that, stretch to feel that.
Mm-hmm.
Okay, so then we hold that, and we could do that a few times and come back. And then we can also do that for the levator, as well as similar kind of manual stretch. And then another technique that we can do is a strain counter strain technique. And so for that, we're going to do, I'm going to passively move your arm up above your head. I just want you to relax for me, okay? We probably have a longer table. Okay, so what I'm going to do is I'm going to find the tender point in your muscle back here. Is this about where it's hurting most?
Mm-hmm.
I know you mentioned that earlier.
Yep, right there.
Okay, perfect. So then we want to put the muscle in its most shortened position. So we're basically going to do the opposite. We're going to side bend towards, rotate opposite, and then extend a little bit. We're going to hold that for about 90 seconds until the muscle relaxes. And then bring you back slowly into that neutral position. Okay, and then we'll bring your arm back down. Alright. So those are just some manual kind of things we can do. I'm also going to have you sit up, and then we'll do a few other exercises. Probably falling over. Okay, so what we're going to do is an exercise where you bring your arm up in front, and then when you bring your arm out to the side. But this lovely broom can help you out. So I want you to go as far as you can. So we don't have that 90-degree precaution that we talked about before. And then you can use the cane to help push you up a little bit further. And then we'll also do it going out to the side. Okay, that makes sense? Okay. May or may not just stand up.
Up as much
Yep,
as
up as far as you can go. And then use the cane to push you just a little bit further. Perfect. And I want you to hold that for about 10 seconds. And then relax. And then do it again. We'll do it 10 times for 10 seconds. Great. And then we'll have you go out to the side. Same kind of thing, go as far as you can. Perfect. And then use that to go a little further. Great. And then again, hold it there for 10 seconds. Bring it back down. Okay. Perfect.
Okay, so the first follow-up question, what would we do if the patient had the axillary web syndrome and how the treatment would be different? I mean, we would still do the same, like myofascial release, soft tissue mobs, and range of motion, but we would add in some cross fiber massage and a load, long duration stretch to really just try to lengthen out and decrease how taut it is. So those are the two things that would be a little bit different than just a regular mastectomy treatment.
Perfect. So then the next follow-up question is, what could the patient do at home to help with the muscular discomfort? Just some basic self-stretching can help a lot. Some of those exercises that we were doing earlier, the patient can do those at home as well. And then like a massage to the area can often help a lot. And then some patients prefer heat, some patients prefer ice, kind of just depends on what they feel helps relieve some of those symptoms.